Gentlemen and ladies, welcome to this lecture. It's about Autacoids, a continuation of Autacoid pharmacology, and specifically looking at the eicosanoids. This covers a number of chemical substances, including prostaglandins and thromboxanes, platelet activating factor, kinins, and all those ones. Now, I think our focus is to be able to understand the source or generation of these eicosanoids and how we can zero in now on those that, for the common drugs that we have that relate to this pharmacology, we will try and zero in on those. So phospholipids are the major source of eicosanoids, and it's through the phospholipase A2 activity that will have sub pathways of arachidonic acid and phosphoralkaline pathways. So under phosphoralkaline pathway, we have platelet activating factor that is produced, and it's very, very important in recruitment of immune system, cell-mediated immune system. Then we have the arachidonic pathway or arachidonate pathway. This pathway involves the 15-lipoxygenase and 5-lipoxygenase enzymes, including the cyclooxygenase subpathways. Now, these three, they produce lipoxins, cycloendoperoxides, and leukotrienes, respectively. For leukotrienes, lipoxins are also involved in recruitment of immune cells and immunity. We are mostly interested in this cyclooxygenase pathway, and it's very, very important. We'll also come and visit this and the discussion of analgesics. So the cyclooxygenase pathway is a pathway involving the conversion of arachidonic acid into cyclic endoperoxide by the cyclooxygenase enzyme, and this produces prostaglandins of different types and thromboxanes. These we are going to discuss and look at their physiological and pharmacological effects, and then we look at what are some of the chemical substances that are metabolites of the same, or they can be analogs of the same that can be useful in clinical settings. So the source of non-steroidal anti-inflammatory drugs, the prostaglandins and thromboxane synthesis are affected by non-steroidal anti-inflammatory drugs. And I think that's their major mechanism of action in how they reduce inflammation and relieve pain. Prostaglandins are widely distributed in the brain, where they affect temperature regulation, most importantly, but also affect a number of physiological effects involved in co-transmission, the lungs, the liver, the kidneys, adrenals, ureters, testes, prostate, so many of these tissues. The major prostaglandins are prostaglandin E1, E2, E3, prostaglandin F1 alpha and F2 alpha. The rest of the derivatives of these derived basically from the same, but those are the major ones. What would be the mechanism of action of prostaglandins? Like most chemical substances in the body, they produce their physiological pharmacological effects by binding to receptors. The receptor type in this case for prostaglandins are G protein coupled receptors, and the second messenger through which they produce their physiological effects is increase in cyclic AMP. The pharmacological actions quickly: prostaglandin E2 and F2 alpha causes contraction of longitudinal and circular muscles of the digestive tube, and because of this they can increase motility of the digestive system. Larger doses of prostaglandins can actually inhibit gastric secretion. For the vascular smooth muscles, prostaglandin E2 and prostacyclin, prostaglandin I2, they are very important in causing vasodilatation and eventual hypotension. While prostaglandin F2 alpha and thromboxane can actually cause vasoconstriction and reverse those effects. Platelet aggregation is influenced by negatively by thromboxanes, but positively in terms of reducing prostaglandin platelet aggregation. We have prostaglandin E1 and E2. Therefore, chemical substances that can mimic the effects of prostaglandin E1 and 2 can actually be useful in thrombolysis. For the respiratory system, mostly we are trying to focus on bronchospasms and control bronchial smooth muscle, bronchial airways. Prostaglandin E1 and E2 and I2, they cause bronchodilation and so can be helpful in relieving bronchospasms. But prostaglandin F2 alpha and thromboxane can actually cause bronchoconstriction. For the renal system, we are mostly interested in glomerular filtration, which is a hallmark of nephron function. There are other functions within the nephron physiology, but glomerular filtration is crucial. And we see that prostaglandin E1 and E2 and I2, they cause vasodilatation and increase blood flow through the afferent arterioles, and so they will increase glomerular filtration and increase excretion of sodium. They also enhance the release of the renin. Prostaglandin E2 is involved in renal phosphate excretion. Thromboxane is counteracting these glomerular filtration physiological effects. The reproductive system, you'll be interested to know that prostaglandins and thromboxanes, mostly prostaglandins, are very important in the fertility of males, but also very important in the physiology of labor. Prostaglandin E2 and F2 alpha, they cause contraction of the uterus. So if the uterus is pregnant, then there can be evacuation of the uterus. If it is before term, then that would be abortion. If it is at term, that then can be induction of labor and eventual delivery of the baby. Okay. Then the concentration of seminal fluid containing prostaglandin less than 400 micrograms per ml is an indication of infertility, potential infertility. And so we expect that prostaglandins above 400 micrograms per ml in males in seminal fluid can actually be positive associated with male fertility. For the central nervous system, temperature regulation as well as sleep, they are influenced by prostaglandin, and so we observe that prostaglandin E1 and E2, when injected into the cerebral ventricles, they can increase the body temperature. Prostaglandin E2, when infused in the cerebral ventricles, can produce sleepiness. It's one of the reasons you see that when we come and look at the pharmacological effects of non-steroidal anti-inflammatory drugs under analgesics, you notice that they also share the ability to reduce temperature by reducing the prostaglandin levels in the central nervous system. Neurotransmission, prostaglandins have been seen that these compounds can inhibit release of norepinephrine or noradrenaline from postganglionic sympathetic nerve endings. So they can influence how tissues are affected in the sympathetic nervous system. Neuroendocrine function, prostaglandin compounds promote secretion of prolactin, growth hormone, basically the function of the hypothalamus. For bone connective tissue, prostaglandin 2 increases the turnover of bones. Therefore, prostaglandin T2 levels reduction or decrease, for example, in postmenopause women, can be associated with problems related to menopause, which can be as a result of poor bone physiology or bone loss, leading to fractures in those who are menopausal women. For the eyes, in terms of control of intraocular pressure, prostaglandin F2 alpha has been associated with a decrease in ocular pressure, and so can be very useful in management of glaucoma. What are the clinical implications of this? Can we apply this physiology of prostaglandins? The answer is yes. So prostaglandin E2 and F2 alpha, remember, they have an effect on the uterus. They can be very useful in termination of pregnancy. They are indications for termination of pregnancy. They can also be useful in induction of labor if the pregnancy is at term. Advantages of prostaglandins over the conventional traditional medicines that increase contraction of the uterine muscles is that prostaglandins are much safer and they do not affect heart function. Prostaglandins also, compared to oxytocin, have no effect on water balance. And prostaglandin E2 and F2 alpha are also involved in primary dysmenorrhea, and so painful periods. If we give drugs that reduce prostaglandin levels, they can be very useful in managing that. Prostaglandin I2 is useful in sexual dysfunction, as we mentioned, such that if it is injected in the cavernosal muscle, cavernosal area of the penis, then it can improve potency of the male. Cardiovascular system indications, prostaglandins have antihypertensive effect because of their vasodilatory and sodium loss effect. Prostaglandin E2 is useful in pulmonary hypertension and also in Raynaud's disease. For the blood, remember we've talked about how prostacyclin can be useful in inhibiting platelet aggregation, so it can be useful in preventing platelet aggregation. The respiratory system, formulations of prostaglandin E2, especially aerosols, can be very useful in relieving bronchospasms. For the GIT, prostaglandin E1, for example, the analog misoprostol, has been useful in high-dose use of non-steroidal anti-inflammatory drugs like aspirin. So if it is being given in high dose to protect the GIT from ulceration, an analog of prostaglandin E1 is given misoprostol, but it is also stimulatory on the pregnant uterus, so it is also useful in induction of labor or termination of pregnancy. For the immune system, of course, prostaglandins can actually be useful in inhibiting mounting of immune response, especially in transplantation of organs. Therefore, if we introduce those, they can be very, very useful. But thromboxanes can actually work against transplants. For the eyes, prostaglandin F2 alpha analogs like latanoprost, very, very important in glaucoma patients. What would be the adverse effects that we need to worry about? GIT upsets, headaches, dizziness, bronchospasms, allergic reaction, syncope, hypertension, depending also on the type of prostaglandin involved, and uterine lacerations as a result of spasms of the uterus. I've left you with this summary of some of the prostaglandin analogs that can be useful in clinical settings. We have dinoprost, dinoproston, prostadil, epoprostenol, misoprostol, latanoprost, iloprost. Thank you very much. Best wishes in your exams.